Good morning, good afternoon, good evening, colleagues. My name is Serge Capto. I am policy specialist in the SDG integration team, and I'm also a member of the Integrated Policy Practitioners Core Team, the interagency core team that manages the IPPN. I am pleased to welcome you to this 22nd session of the IPPN Knowledge Cafe. For those joining us for the first time, IPPN is an initiative of 10 founding UN entities to create a community space where we can share lessons and experiences and strengthen our collective capacities to apply integrated policy approaches in concrete and practical ways to support the implementation of the 2030 Agenda. IPPN is primarily a UN interagency network, though it is open to colleagues in government, academia, and the broader development community. IPPN is jointly managed by UNDP, UNESCO, UNFPA, UNICEF, ILO, and FAO. The purpose of this monthly series of knowledge cafes is to showcase insightful experiences of policy integration for accelerating progress on the 2030 Agenda. The session today will discuss intersectoral approaches to disability inclusive and gender responsive budgeting. We will notably explore a concrete example of UN joint programming to ensure representation of persons with disability in the local planning and budget processes in Nepal. Before I hand over to our speakers, here is our usual note on housekeeping. Please make sure that your microphones are muted to allow colleagues to hear the presenters. Do use the chat function to ask questions or share your experiences and insights throughout the session. After the presenters, we'll open the floor for discussion. We have real-time captioning available today, as well as international sign language interpretation. Please enable captions in the Zoom panel below on your screen. The captions can also be accessed through the link provided in the chat. If you have any query related to accessibility during this event, please feel free to reach out to Yeva Keskine, who is among the participants, by writing to her in a private chat. Our speakers today are Monjuru Kabir, Global Advisor and a Team Leader for Gender and Disability Inclusion in UN Women, Santosh Acharya, Program Specialist in UN Women Nepal, Binda Magar, Governance Advisor in UNDP Nepal. I am very happy that we are also welcoming Sherry Nicol, who is the lead on gender budgeting in the Organization for Economic Cooperation and Development, who is joining us today. I'll start with Monjuru. You were with us already back in October 2022 to discuss the importance of intersectionality for disability inclusion in policy and program implementation. I'm quite happy that you're back to us in the IPPN to share the progress that you've made since then and the insights that you've learned. So, Monjuru, what's been happening in the past year or so?
Thank you very much, and Sergey, but I'm also equally, if not more, delighted to be back because IPPN, to me, stands out as one UN approach to knowledge exchange, not only knowledge in the sense of it's a global, but it's cross-regional, local, and national, which is a virtuous cycle. Now, in our last cafe, when we launched and also introduced UN Women Global Toolkit on intersectionality, we addressed the intersectional approaches, and a lot of colleagues also asked us about examples. Today, we are actually also giving you a very concrete example. On the previous cafe, we gave approach and number of country-based examples. The example today we are sharing is not only country-based, but also cross-regional and global. And I'm so pleased that our colleague from UN Women and UNDP Nepal joined us along with OECD colleagues on gender responsive budgeting as well. Now, my presentation is focusing on the whole notion of disability inclusive budgeting that is gaining traction now globally with member states, with organization of persons with disabilities, with different groups, including private sector. And we're looking at different approaches to learn from it so that In the same way, UN CRPD is one of the very few UN human rights treaties which becomes one of the most modern human rights treaty because it also learned from past lessons from other human rights treaties prior to UN CRPD. In the same way, disability inclusive budgeting is looking at gender responsive budgeting, example, success, lessons learned, and in some cases even failure, and how can we do it better. And we are also combining in cases where it matters to approach together. Next slide, please. Now, this is very obvious, but I just want to give you a flavor that why it is important to have this approach. Gender disability gaps are rampant globally. Despite global normative commitment, the rights and needs of women and girls with disabilities continue to be marginalized in legislation, in policies, and programming. To just give you an example, many countries' national law does not even address the whole issues of legal representation, guardianship, access to maternal health care, SRHR services, gender-based services for women and girls with disabilities, let alone even acknowledge the critical requirement of disability inclusive care services. So that's the gap I'm talking about. Research in 2022 on 190 economies highlighted that almost 16% have gender equality laws that mention women with disabilities. So you can imagine the gap, almost 84%. The gap is too big in terms of even referencing or mentioning it. Only 27% have disability laws that specify gender or women with disabilities. So that is the context we are talking about. Next slide, please. Now, how do you address the gaps? Because that is a big challenge for us as we are approaching 2030. We already crossed the midpoint. We know there are severe gender gap as well as disability inclusion gap. And as we are talking about the future agenda, summit of the future at the UN level, but also thinking about what could happen post 2030, it's important that we address the gaps in the remaining year to the extent it is possible, and also position us as a UN system and overall international development that how can we address the future challenges. Now, gender responsive disability inclusive budgeting can strengthen the alignment of public budget with national commitment to gender equality and disability inclusion. Public budget and gender responsive budgeting as entry points for inclusive budgeting, as we are talking about. The tools of gender specific GRB can certainly support intersectional analysis of the public budget, including disability inclusive budgeting. It is important, though, to determine priority areas for initiating gender and disability analysis in fiscal policy, budget framework, and implementation mechanism. The reason I'm saying, because if you hear the presentation by finance minister, by social sector minister at the high-level political forum in New York, you will see that many countries differentiating their same priority because of their contextual approach is different. And there is diversity. So there's no one size that would fit all countries, all regions. So country X might prioritize entry point from social sector. Country Y is prioritizing from a humanitarian action point of view, given the situation they're facing in their own critical juncture of transition. Next slide, please. Now, from the GRB approach, what we learn from disability inclusive budgeting, particularly colleagues who are working on disability inclusion at the country level, at the global and regional level. They're looking at analysis and tools, particularly GRB identifies gender gaps, planning of gender responsive intervention, alignment of budgets with these policy and programmatic intervention, and assessment of particularly the impacts. Now, we are really highlighting and advocating for intersectional analysis, because to our understanding that UN system and member states has capacity and knowledge gap on intersectional analysis, and that gaps can be mitigated through this analysis because that would give you a number of unique context and address the capacity gaps of the national and provincial level. My colleague Santosh would focus on provincial level in Nepal, but I would also say that there are severe gap at the subnational and national level. Recently, there have been efforts to apply an intersection analysis to budget, drawing on GRB tools as part of the wider policy efforts to implement CRPD and commitment to disability inclusion under the SDGs and NLP approaches. Now, this is certainly GRB tools plus, because a number of areas where we are looking at accessibility, we are looking at inclusion, we are looking at from other angle too, because accessibility is in humanitarian action, accessibility in structured financing, accessibility to. So there are a number of windows which are being explored by colleagues at different levels. Next slide is. Now, this would give you, I'm not going to go into details for the interest of time, but I'll just give you a flavor that whole gender disability cycle that emanates from assessment and planning. It looked at review and approval, implementation, evaluation, and audit. And just to give you an example, so that you understand the dynamics, how important this is, we have worked with auditors from all regions recently and trying to understand how we can audit leaving no one behind principle of the SDG. And in that, disability inclusion is a critical area. We also recognize that auditors don't have tools, because auditors who look at compliance auditing or performance auditing have difficulty of auditing the national government's commitment to leaving no one behind. How do you audit something which often are not strongly visible at the interministerial level or interdepartmental level or commitments through budget? So our approach is this: if we do an intersectional analysis, if we connect existing tools, and if you open up for OPDs and informed consultation along with parliamentary review and approval process wherever possible, we are advocating for parliamentary review, and also at the assessment level, looking at both gender and disability gap, it makes a huge difference in terms of understanding the reality and trying to cover the gaps that we confront as a whole. The next slide. This is an example where education sector budgeting can be benefited from. If you can take a gender analysis, on the left side of the slide, you can see the example of it. You can do a standalone disability analysis as well. But what we have recognized that if you do a gender and disability inclusive analysis, you would then look at accessibility not only from the perspective of disability inclusion, but you look at accessibility from the perspective of gender, from the perspective of women and girls specific and unique needs in normal context, also in humanitarian and conflict setting. Also, you look at budget allocation, how it is being targeted, whether budget allocation targeted to improve educational outcome, or it also look at girls with disabilities and their own vulnerabilities. Are indicators to monitor budget performance disaggregated by gender and disability status, or only gender or disability status, right? So in the middle part, we would be advocating for that let the whole process become more gender and disability inclusive. And therefore, it becomes really inclusive education sector budgeting. This is one sectoral example. You can have other sectoral example as well. Next slide. So here we are leaving some of the recommendation for governments, also for civil society. I would not go into details again for the interest of the time, and maybe we'll respond to some of the questions in the Q&A. But the most important thing I would highlight, though, we know that it's important to align national policies, capacity building, and build the evidence base and data set. But most importantly, whether we have a right and enabling legal framework. In many countries, government agencies are not bound to provide disability disaggregated data. Many countries, they don't have the recognition of legal representation of women and girls with disabilities at various levels. So it is important that law reform takes place in the same way legal reform takes place post-Beijing in many countries on gender. And we are at that level where we are calling for both gender and disability inclusive recognition in the legal framework of the countries. Second, next slide. I have already covered this slide. For the civil society, of course, the voice and agency and coalition building is critical for their support and connection with OPDs. Here, we are also calling for greater integration and collaboration between gender and disability movement. And we are looking forward to forming advisory committee wherever possible to develop a disability advisory committees comprised of women with diversity of disabilities, wherever you have a discussion on budget and other processes. In the same way, we are integrating mainstream women's group. And probably the last. Next slide. So I will stop here, but I also want to inform moderator and colleagues who has joined today and my co-panelists that UN Women has recently launched a publication on disability inclusive and gender responsive budgeting. We did this publication together with our GRB team in UN Women. So GRB and Disability Inclusion team joined up and worked together and provide some finance example and good practices. The link will be in the chat. So I will urge you to have a look at it and give us your critical feedback. Thank you very much, and over to you.
Thank you, Manjurul. Very pleased to see that you've been very busy since we met last time. That's excellent, colleagues. Really urge you to download and read these new policy reports by UN Women on gender and disability inclusive budgeting. It provides these policy options and recommendations, as well as entry points for intersectoral analysis as presented by Manjurul. Please, if you have questions for Manjurul, post them in the chat. Please type them now so that we can come back to them after you've heard from the other panelists. Now we'll turn to Santosh, who has been working with Binda on joint programming in Nepal to implement these approaches. Santosh, how does it work in practice at country level? We're keen to hear from you. Over.
Thank you so much, Sazri, and thank you, Manjurul, for setting the context very nicely. So today, it's my pleasure to present the work that we are doing in Nepal together with other sister agencies, UNDP and WHO. It's a part of UNPRPD funded joint program, which is titled Disability Inclusive Development in Nepal. And my presentation would include our work at the local government level to advance the gender and disability responsive budgeting and planning. So to begin with, I want to start with the national context in terms of gender disability budget. And then I also want to get the picture because Manjurul talks based on the criticality of evidences. And we recently had this National Population and Housing Census 2022, which shows that only 2.2% of Nepali population with some form of disability. So I think the key challenge begins right from there in terms of how this data are captured and then whether it's based on the types of disability or on the functionality basis. And then as a part of our joint programming, we advocated for the census data gathering based on the functionality, but then it was not materialized. And still there are questions around the data that has come up with, but this is the latest data we have. And in terms of GRB guideline, Nepal has started working on gender responsive budgeting since long, around 2006-07. And then they have come up with this GRB guideline to, to structure and harmonize the work on gender responsive budgeting. And this guideline, and also like with federalization, they have also come up with the model guideline for sub-national level. And these are the key, entry points for Nepal country office to start working on gender responsive budgeting. And the good part is the Ministry of Finance at the federal level, they do also have the gender responsive budgeting committee led by Minister of Finance, and then UN is part of the GRB committee, which provides also the entry point in terms of influencing the GRB process in the country. And then is Manjurul talks based on federalization of Nepal in terms of governance structure, moving from unitary to federal system. That was an opportunity in terms of how we can directly engage with local government and provincial government. Because budget or gender responsive budget is a part of public finance management, and public finance management is a bigger sphere in terms of political economy, and it's not easy. It's not easy to influence and to advocate for the to influence the budgeting process. But then with the federalization, it really gave us entry points in terms of piloting and scaling of some of the models to engage at the local governance level and really show the examples on how this gender responsive budgeting tool can be expanded. And then I think Monzeril touched this from the intersectional lens and from Nepal country office, how we are also looking into it in terms of GRB guideline or GRB processes. Within gender responsive budgeting, we talk about women and excluded groups and bringing intersectional lens more from the disability perspective within the existing GRB guideline already provides the entry point to bring the issues and agendas of disability, for community of disability people. So we are not approaching this with a silo or new, guideline or tools, but then how we expand from the intersectional lens in terms of using and capitalizing this. And also we have the endpoints in terms of Local Governance Act 2017, which has adopted participatory planning and budgeting process, and clearly mentioning that population or person with disabilities should be the part of the consultation process. However, the challenge is the disconnect between GRB and public finance management. Sometimes GRB is taken in isolation, and those who are talking public finance management, they are not referring, or even those people who are talking about gender responsive budgeting, they are not referring the entirety of the public finance management. So there's still a gap. And also, capacity, despite will and interest. I think this is what some of the questions that are coming up is how we do that. There's interest, there's appetite, but then what are the tools and strategy that can really help to work on it? And then the other thing is, GRB is often limited in the planning phase, and then the implementation monitoring is not there. So these are some of the contexts that we are dealing with, just to begin with. And then moving to the next slide, I just want to give a quick intro in terms of the joint program, which is titled Disability Inclusive Development in Nepal. The project period, this is the second phase that Nepal country office together with other assist agencies are implementing. We had the first phase from 2018 to 2021. This is project size as 700,000, including the design phase, and we are implementing in 2 provinces, together with UNDP, UN Women, and WSO. And here we are looking more in terms of engaging with stakeholders to come up with knowledge and tools for disability inclusive policies, addressing the gaps in achieving CRPD implementation preconditions, and ensuring national policies and budget gender and disability responsive. Now, in terms of quick results, I have framed this on the 3 broad areas based on the pilots or the interventions that we have done in the local governance structure. And one is definitely we have seen increase in budget allocated or targeted for women and persons with disabilities. But then here also being mindful that sometimes when you talk about gender responsive budget, there's often a confusion that it's a targeted program for women or excluded groups, and then lose the context of how we claim access and how we benefit from the entirety of the budget that the local government or the central or federal or provincial government pulls on. So I think bringing that lens and then looking from the sectoral perspective, sometimes there might be increase in budget for gender programming or for programming on disability inclusion and rights. But what about education sector? That has a huge impact on the lives of women and girls with disabilities, or health sector that has so much to do with services. So are we also bringing intersectional or sectoral lens? And when we review and say that there's increase in budget, and we have reported progress in terms of influencing sectoral areas as well as mainstream or target intervention for women and girls. That's one key areas where we have been able to work. And then the other is the opportunity we were able to tap in is federalization, like local and provincial governments. There was a need to come up with gender equality and social inclusion policies. And we were really able to tap in this opportunity to also pre-position disability in the gender equality and social inclusion policy. And now in Nepal, there's a initial acronym like JC policy, gender equality and social inclusion policy, but now disability has been very much pre-positioned or foregrounded in the JC framework, and calling it more the ZC policy, which talks about gender equality, disability, and social inclusion. I think that's a huge progress we have enabled. And even the 16 periodic plan that Nepal is about to finalize that already integrates the notion of bringing and pre-positioning disability, in the JC framework, gender equality and social inclusion framework. The other is, we have been able to increase, representation of personal disabilities in local level communities, and these are very key and vital. As a part of the legislation, local level coordination committees in vision, which has a mandate to advance disabled rights and inclusion. And then all municipality has to form and operationalize these local level committees, but then it has not been materialized. So through project intervention, we have been able to operationalize this, help them to understand the role and mandate and implement, disability rights and inclusion and advocate for mainstreaming at different sectors. And also establish similar disability highlights or focal points in project municipalities, we call local government units. That's also like, sometimes it looks very simple, but also I think it has a huge role to disseminate information, to give information about planning and budgeting cycle and invite them, in the processes. And the other is enhanced participation and representation, because Nepal has adopted this participative budgeting and planning process, which is a 7-step process that is right from the community. And then through project intervention, we have been able to equip with necessary knowledge and skills for women with disabilities or possible disabilities per se to engage in these processes, because then without engaging in the formal processes, it would be really hard to negotiate at the end, So how we also, promote bottom-up approach in planning and budgeting, and then ensure that women with disabilities or personal disabilities are part of this planning and budgeting process. And also looking from the diverse sector, like the humanitarian context, the DRR committees that exist over there. How we also advocate that women with disabilities or personal disabilities are not only part of the gender planning process, but also part of the DRR committee or education committee or other sectoral committees. So these are some of the examples that I want to share and we have been able to come across. And now moving to, Manjur has already captured, but one of the key learning that we all have now realized is sometimes we talk so much about gender equality and then inclusion of personal disabilities, but the first and foremost precondition is that we need to interact with them. We need to bring them on the table. And this should be the people who should be leading this discourse, They are the repository of knowledge in terms of challenges and opportunities. So how we engage with them and partnership with women-led OPDs, definitely from the custody of women is one of the end point for us, and then how we bring intersectionality within women movement, like working with indigenous community or women with disabilities from indigenous community, partnering with diverse networks and organization of personal disabilities. The other is how we make intentional efforts to include women with disabilities or other vulnerable groups in the programming. Because often we face a challenge where we say that this is the targeted program interventions for women with disabilities, but then the repercussion of the feedback is we tried our best, but then we are not able to reach out and they are not there, we can't access. But one of the strong messages we have been reiterating that inclusion has a cost. It needs resources. And without it, we cannot make it happen. So how we are pre-positioning ourselves intentional to make those investments, to have the threshold that these are the non-negotiables. And that's how we have been working and designing the intervention at the field level. And the other, I think, one of the contribution from the project is integrated policy approach, we would say, because often gender movement or women movement is one part, women with disability, within the segregation or silos within the women movement or within the vulnerable groups. So through this intervention, we have been able to well package and solidify gender and disability together. And they comes. And adding disability is not something new, but it's more bringing the intersectional lens. And it can open up to diverse intersectionality, but then bringing gender and disability together in terms of policy, programming, budgeting, that's that's the other area we have worked, and that has really solved in terms of shaping the policy and programming and budgeting. And then also bringing this diversity, inclusion, or intersectional lens in terms of age, caste, class, and geography, given that Nepal is very diverse community based on caste diversity, geographical diversity, others. And then this is my last slide, but then some of the key lessons learned and takeaways is for Nepal countries, like public finance manager influencing is not easy. And then until there's some accountability mechanism or framework for the government, they do not easily convince or agree. So it's very important that we map and leverage what are the strategic entry points more from the legislation perspective. For us, the legal framework. The periodic plan says they want to promote and decentralize the GRB framework at the local governance. That's a very strong accountability measures. GRB guidelines, local planning and budgeting process are a very strong commitment from the. So how we also tap in those accountability measures that government has committed and those legislation. If there is not, I think there should be a focus in terms of how we strengthen the legislation so that there's accountability measures on the side of the government. Second is institutional strengthening. Sometimes there are policies, but there's a gap in terms of institutional capacity to deliver those. For here, like in Nepal, our own experience, like for example, there is a model guideline on GRB implementation for sub-national government, but there's no capacity with the local government to really implement and roll out So we invested in terms of system strengthening, their capacity development and understanding in terms of GRB. I think that's key. Evidence building, because until there's no evidence, then it's very hard to convince. So, one of the exercises we did is review of the local government budget from gender and disability, bringing intersectional lens into it. And that really gives the evidences in terms of where we stand against the commitment that we have in our legislation or constitution. And also, I think Monzo also talks best in terms of sectoral GRB analysis. I think that's a very powerful tool. And this very much links with my next point in terms of life cycle approach to gender and disability responsive budgeting, because often GRB is talked more during the fiscal budget speech and during the planning phase, but then it is left out in the implementation, monitoring, and the expenditure tracking. That's missing. So how we bring the life cycle approach to gender and disability responsive budgeting so that it's not a one-time tick-off. It's a life cycle approach throughout the fiscal year so that there's a kind of tracking mechanism, a robust mechanism to track this. Capacity development, both on CSO side, women's movement, disability, organizational person with disabilities, and also the duty bearers. How we also equally equip right holders and duty bearers. So there's a demand and also capacity to supply those needs. That's the other area, I think, a key takeaway for us. Collaboration and partnership, I think, as you know, we are bringing women's movement and the women's disability movement together. Because sometimes we are working in silos, and it's very important that we also, interact with the non-traditional actors in the to influence the domain of public finance management. So that's the other area I want to, share with the audience. The other most important, some often we miss is we are so good in advocating what others need to do, but then how we reflect ourselves. What are the processes and measures that we need to reflect? How we looking inward to solve better outward? And I think that's very important. And then strengthening our own capacity. So even I have faced questions sometimes, okay, you are managing, programs on disability inclusion, but you are not the person with disability as such, and how you bring that lived experience, And I take this with so much of, respect, because that's very important question. And then how we look inward to strengthen the capacity to interact more, to know the nuance, and then bring them in leading those conversations. So, and last but not the least, we have been talking about generous budgeting need, but then there's also a kind of gap in terms of analyzing or measuring the impact of GRB. Some of the gender responsive programming, because often, like when you talk about women's empowerment, gender inclusion, or equality, it's more the social sector, soft sectors, and then some decision makers want more concrete and evidences that it has really impacted. There are impacts, there are evidences, but then how to package it to it? How we also invest in terms of measuring the impact on GRB initiatives and then response and disability initiatives. I think these are some key takeaways, and I'll be happy to respond. I think I'm on the last slide, and then if there are any queries, respond. So with this, I in my presentation, and thank you for listening.
Thank you, Santosh. Binda, I understand that you were involved as well in this joint program. Anything that you wish to share?
Thank you so much, sirs, and also thank you, the organizers, for including UNDP Nepal along with Santoshi from UN Women. He has already placed a very good background, the work that we are doing together in Nepal, and the overall movement, the efforts of the UN agencies on disability inclusion in Nepal after the federation, mostly after the federation. I will just touch base on few of the work that we do together as a part of the Disability Inclusion in Nepal program, which is funded also through the UN PRPD. And my focus will be more on the policy level work. So with regard to the UNDPs that we do right now, we have done a review of the Disability Rights Act, which was adopted in 2017. Why this was necessary? I mean, it seems quite new in terms of in terms of the number of years, but at the same time, what the OPDs had come up is the act that has categorized the persons with disabilities. It doesn't include everyone, so there is need to review it. So one of the major part was to review this Disability Rights Act with thorough consultations with the OPDs, keeping in mind the intersectionality among the OPDs. That was the main concern and the thirst that we took into. Right now also at the federal level, we have submitted the reviewed policy, but at the same time, the consultation with the provincial level and local level OPDs is still ongoing. It is yet to be completed. So this is still work in progress. At the same time, I remember Manjurul, you mentioned about the right of the women with disabilities, the reproductive health right aspect, and this is precisely one of the act that Nepal is also supporting the government in terms of reviewing this act from the women with a disability perspective, and I see this as one of the great opportunity for all the UN agencies in Nepal and the OPDs working on this particular topic to really contribute and make it more substantive and going forward useful to the women and girls with disabilities in Nepal. As Manoj, as Santoshji also touched base a little bit on the federalization and how we all are supporting at the local level. One of the part which is not through the UN PRPD, but I would like to share here because this might be useful for all the audiences also. UNDP through the larger one flagship program of Nepal provincial and local government strengthening support program had also supported the local government by developing a model law on how local government can develop their policies more disability responsive. So that is also one of the key area, and it has basically impacted with all the 753 local government and provincial level government are also being supported with the policy formulations on disability inclusion. These are some of the policy level which I would like to share with you all. But going forward, as it was also shared by the previous presenters, the lack of data and disaggregated and reliable standard data on disability has been a major challenge globally, and Nepal is not an exception. We have been facing this, even though we have the data from the 2021 census, but at the same time, these data are not up to the mark. There is a strong demand from the OPDs and the national umbrella federations of the OPDs to really go and revisit this, and there's a demand to the government to also do a national disability survey in the coming days. So based on the 2021 census, UNDP through the UNPRPD support, we also supported the National Statistical Office and the umbrella organization of the National Disability Nepal in Nepal, NFDN, to really come up with a statistical report on disability. So this report provides the overall detail of the census based on at the federal, province, and the local level, which will serve as the basis for any planning and programming in the coming days. And the plan is also to have a larger national level disability survey in the coming days. So this is something which is work in progress. I will also like to touch base on 2 points, and then I will hand over to the moderator. As you heard from the previous speaker, like inward looking and to look into our own system and to ourselves, like how we are internalizing this issue and how we are implementing is also very, very important. Hence, UNDP has been working with UN Women, WHO, and other UN agencies here, also with RC office, on making our premises disability responsive and friendly. So having disability inclusive restrooms, all gender restrooms, and we also have created a platform for the OPDs and the UN agencies to come together and learn on the issues and topics. Also, we are encouraging to mobilize experts from OPDs only on the issues of OPDs. That has been a core that we have started. And most importantly, the sign language interpreters. The service providers are also trained on the sign language interpretation so that they are aware of the needs and the services the OPDs could need when they are in the UN house. And last point is basically UNDP is right now supporting through the human resource also to the Ministry of Women, Children and Senior Citizens, who is a nodal ministry for the disability issue. And the national framework for Leave No One Behind was developed with the National Planning Commission, which basically identifies persons with disability as one of the key community to reach out and to address when we are talking about Leave No One Behind and the sustainability and the indicators that we need to meet by 2030. So with this, I would like to end, but I will be very happy to come back if there is any specific questions on the work that we do in Nepal. Thank you so much. Over to Serge.
Thank you, Binda. Thank you, Santosh. That was quite impressive, the work that you're doing in Nepal. Congratulations for all that progress. It was quite interesting to hear, Santosh, about the strategic prioritization of the legal framework. Also heard it from Binda as an entry point, really, to enable this kind of work and ensure that it is a commitment from the duty bearers, from policymakers to advance on implementations of these laws, including at local level. I really took away the point that you made that this is not about targeting, right? So we really need to look at all the cross-sectoral perspective and issues that would impact people with disabilities and women with disabilities. And of course, the data challenges that you mentioned, Binda, and the mundane issues, it might seem mundane, but to enable really participation of people with disabilities, that the kind of support that you provide on training for sign language interpretation, these are, we don't often think about it, but these are important barriers that you help overcome in the context of that joint program. So really thank you for that. I'm going to turn now to Sherry, who is joining us from OECD. Sherry, we're really happy that you are with us today, because we also need to understand how, in the other country context that we do not necessarily support as part of our program countries, these approaches on intersectionality, policy integration are taken, and we do love to hear from you and learn from your experience as well. Over to you, Sherry.
Thank you so much for the introduction. So yeah, I guess the OECD has been working in the area of gender budgeting now for almost 10 years. And one of the main ways through which we stay in touch with the latest developments of what's happening is through our OECD network on gender budgeting. And it was at last year's meeting that we had a session exploring gender budgeting and intersectionality. And as a result of this, we ended up publishing this paper that's in front of you, drawing on OECD country experiences in this area. Next slide, please. So what did we find? Well, I think there was a range of things that were interesting for us. First of all, intersectionality is a relatively new concept for many of the countries that are engaging in gender budgeting. There's just a handful of OECD countries that are having an intersectional approach to their gender budgeting. These include, for example, Canada, Finland, and Sweden. Some of these countries, they begin with an intersectional approach, and others develop it over time. At the core really is the desire to have gender budgeting more effectively close gender gaps, and there's a recognition that understanding the cross-cutting nature of the gender gaps faced by men and women with different characteristics is at the heart of being able to implement targeted policy action that's more effective at closing gender gaps. A key area where we see this in play is in, for example, countries trying to close gender gaps in the labour market. I'll give you an example from the Australian government Women's Budget Statement in 2023, where they undertook an analysis on how to more effectively close gender employment gaps that found that there were significant barriers faced by women with disability, faced by women from different types of household, and faced by women who had also First Nation status. And then they also found that, for example, those employment barriers were exacerbated for those who were women, First Nation, and with a disability. And so that what that enabled them to do is to undertake an analysis on what are the barriers, the particular barriers faced by those groups of the population, and an understanding of those barriers enabled them to then put in place policies that are more likely to address them. And that's one of the reasons, for example, that the budget in Australia included new funding for a disability employment programme as part of the 24-25 budget. So it can show in practice how this sort of intersectional analysis really helps expose what's at the root of the inequalities and the barriers that people are facing so that they can be addressed more effectively. And at the heart of this is really understanding that without equality, we can't achieve economic prosperity. And so, central to closing gender gaps is the understanding that this is going to not just bring social benefits for everyone, but economic benefits too. One of the things that we found is that there was a lot of confusion amongst OECD countries about the difference between gender budgeting with an intersectional approach and equality budgeting. So it's probably useful just to take a moment to talk about what we found. So we found that gender budgeting with an intersectional approach always comes from the starting point of the gender lens and then adds on additional lenses after that, whereas equality budgeting can start from any lens. It might start from a disability lens, it might start from a race lens, but it's not necessary that these characteristics are systematically included in the analysis. Of course, the main characteristic of the intersectional approach is that it considers not just the impact of these different factors on inequality, but the compounding impact of these identity factors as well. Now, as colleagues have already mentioned, there's a number of challenges in engaging in intersectional gender budgeting. Some of the challenges that our member countries raise to us is, the lack of available data to support analysis. Although we've seen a number of countries make good progress in this area, I'd point you to Wales and Canada, where data audits have really helped understand where the key gaps are and help those countries map out plans in order to close those data gaps. There's also a perception that intersectional analysis is too complex, but really, where countries are able to provide clear guidance and templates that can really help bridge this gap between understanding and implementation. And then lastly, a lack of government capacity to undertake this work. We've got gender budgeting, we've got climate budgeting. If you add on these different lenses, intersectional approaches, then it can start to weigh heavily on the administration. And so what's important is that countries are designing approaches that really help lift each other up rather than compete with each other. And I think core to that is an understanding that what's most important is just ensuring there is good evidence on need underpinning budget decisions, and a clear understanding on what the impact and outcomes of those decisions are going to be. And intersectional budgeting is therefore just good budgeting. Thank you very much.
Thank you, Sherry. That was quite insightful, and also really interesting to hear that the issues, the challenges that you face are kind of similar to the ones that we do face, also in the program countries that we support. We've heard mentions of the issues of data. Data is it's something that comes across basically everywhere when it comes to gender and disability data, and it's a lot of effort to increase availability of data on people with disabilities, as well as capacity needs, right, of governments, counterparts, and you mentioned as well the complexity of policy integration of intersectional approaches, and those are the kind of challenges that here within this network IPPN we really try to tease out how to address these complex issues when we're talking about policy integration and intersectionality, and also the references to the compounding effect of these factors that affect individuals. It's really important to understand them as you lay out, because they just pile up, right? Whether it's the gender, it's the age, forms of disability, origin, caste, all of these just compound to ensure that people feel excluded and find themselves excluded from policy choices. Very, very interesting. Colleagues, you've heard our panelists. We will now take questions. I see that there's been a few questions posted in the chat already, as well as and thanks for the comments that you shared in your registration forms. We also have a number of questions that colleagues have shared with us in their registration for this event. So we will turn to the Q&A. I'll start with Mrs. Catherine Gifford, if you are still online. Catherine, from UN Women in Tanzania, to share also your perspectives and also your reflections on what you've heard and how you're taking this forward in Tanzania. Over to you, Catherine.
Thank you. I hope you can hear me. Thank you so
Yes.
much, Serge. Thank you. And thank you to all the panelists for a really fascinating presentations, and I really appreciate all of the reflections. I am in at UN Women Tanzania, but quite recently, and my previous hat that I wore was actually at HQ working on gender responsive budgeting. And I had the honor and pleasure to work quite closely with my colleague Zora and Manjurul and our other colleague Mary Bell, as well as with others, on the publication that Manjurul referenced. So my reflections will actually be our power just went out, so I don't know if you lost me, but anyway, my reflections will be will be in that regard. So anyway, I just wanted to quickly, while the power is still on, I just wanted to quickly give you a few thoughts. First of all, I just wanted to touch on the points in regard to intersectional analysis and data. I think that we all know that data is a challenge, gender data, disaggregation, but I think, and some of the comments in the chat, I think, have raised this as well, that sometimes just even asking the questions, even starting just from that sort of simple place, while it seems simple, to just really put those questions forward and start to get that thinking around, how do we begin to look for, ask questions and interrogate from an intersectional perspective. Manjurul shared a slide that had an example from the publication that we worked on together that gives an example of that. But I think it's also just to kind of illustrate how some of those types of questions can spark the discussion. And I've seen in the comments that there's been a few reflections on how does this then apply to other areas as relates to intersectionality. And I know we heard that from Sherry and from the others. And just to say also, in the publication, something we have put forward, and I hope is useful, is this idea also of sequencing, because we know countries are at different stages as it relates to gender responsive budgeting. And we've heard from colleagues in Nepal and others in terms of, entry points and opportunities. And I think it's also important that we look at that sequencing and where countries are in their experience on gender responsive budgeting and where those most kind of opportune entry points exist. And then also, how do we build that practice over time and the incremental progress, and recognizing that and capturing that, both for learning and then also for growth. And I also just wanted to say that I'm really looking forward to. I'm now in Tanzania. We are certainly working on gender responsive budgeting. And I think this also affords us a lot of learning and opportunity to think through how to begin to apply some of this work and the lessons from the countries that have presented. So thank you so much, and looking forward to continuing the discussion.
Thank you, Catherine. We had a few questions posted in the chat that I will address to you now, starting, I think, with colleagues Munjurul and colleagues in Nepal, being the Santosh. I think there's a very important question about accountability tools, right, for gender responsive and disability inclusive budgeting. And that this ties a little bit to monitoring, and there were quite a few questions as well that people shared in the registration forms about monitoring for this. So how do you measure the extent that budget policies are responsive? This is a question particularly from Lucretia.
Maybe I can just start.
Yeah.
Can you hear me?
Yes, go ahead.
No, I just want to thank all my co-panelists and also Catherine from Tanzania. Looking forward to building the bridges in Tanzania as well. It's another example of one UN country. Now, the question, I will pick one question, Sarg, which has the element of monitoring, but the question was, how do you really integrate disability inclusion in the budgeting? And of course, it's lessons learned from GRB as well. And this is a question I'm taking up because it has also an element of accountability at the end. And we get this question from a lot of countries nowadays. Our response is, based on our work on the ground, is you cannot have just one type projectized approach on disability inclusion. Of course, it has to be integrated during the budget formulation, but it is as mainstreamed approach as we do for gender. It's also targeted and project-based approach, but it's also the broader issue of inclusive management. And the many countries embrace the three. We call it triple approach, where we are mainstreaming disability and accessibility. Same way, recently, JIU, Joint Inspection Panel of UN Funds and Programs, recommendations on accessibility. They recommended that UN Secretariat, UN Funds Program agencies look accessibility in a more holistic way. And this is somewhat similar. We are also saying that budgetary process has to look at holistic way, not like we suddenly allocate some money for disability inclusion, and then we said, okay, wonderful, we have addressed disability. So if it is a matter of education, matter of social welfare, matter of inclusion, access to justice, rule of law, humanitarian action, everywhere you have the elements of is it really fit for inclusion purpose? It is really accessible. Can government accessible? And you have seen during COVID time, the whole gap was exposed. Many colleagues with disabilities, many friends or neighbors with disability cannot access vaccine, cannot access health services because they were never prioritized, they're never thought of. They cannot have access public transportation, cannot go to a hospital, cannot stand in the line, cannot get the vaccine. I'm just using the vaccine example, but that really shed light on our gap in the public service orientation. So it has to be mainstreamed, targeted, and also the broader issue of inclusive management. In terms of the accountability, of course, I mentioned during my presentation on the parliamentary approval or engagement, but beyond parliament, strong civil society and OPD engagement is a must. And it's not only for tokenistic, that one consultation with a group of civil society. and then we are really good. No, at every stage of the processes, and also asking them about examples and models and challenges, not necessarily only do it from a top-down processes. So these two would be important. And another accountability mechanism we keep saying, like I mentioned, the example of auditors, who are often ignore our development paradigm and thought always as a secondary process the audit will do. But take the example of the auditing and reporting seriously, because auditors do issue recommendation who are publicly funded by the member state, whether it is from OECD member states or it's the UN member states or any regional groupings, right? So auditors play a critical role of auditing development, humanitarian, defense, military projects. And recently, I'm looking at a number of audits from different countries, and it was a strange similarity I saw that from north, south, east to west, different countries, different regions, but auditors are coming up very, very pointedly that yes, your ministry's intervention was not accessible. Health sector was not accessed by indigenous population with disability or women living in the rural areas, and what you have done or your ministry has done. So I'm also applauding our development colleagues here to connect with Office of Auditor General more than usually we do, because we typically see them as a different set and we are not part of their audit recommendations. Yes, it is a very, very different process, but I would also urge that take their recommendation along with recommendation coming from Parliament and other oversight bodies seriously and engage the public hearing process, connecting with OPDs at the local level, at the regional level, at the provincial level. I'll stop here.
Thank you, Manjaro. That's a great point actually to engage with the audit institutions. You're totally right. We don't do that enough. I see that we're quickly running out of time. So I'm going to turn to Santosh and Bida very quickly. If you can share, there's been some questions also about how to foster collaboration between organizations of people with disabilities and the duty bearers, policymakers. How do you enable that collaborative space? I know that Santosh, you've mentioned actually been there as well, and Catherine, the need to question oneself, to look inwards, but how do you make sure, how do you create that collaborative environment between organizations of people with disabilities and the policymakers?
Sure. Maybe I will comment and maybe Bindaji can follow up. So I think I also talked this during my presentation, and this is a very important question, like we talked about looking inward and then also, looking outward in terms of, I think it's again, like it's more the mapping. And I think one colleague from Tanzania well said that different countries are at different stages, but then I think it should be also localized. For example, in Nepal, there's quite a movement of organization of personal disorders. There's a National Federation of Disabled Nepal and also National Disabled Women Association, particularly looking after the disability rights and inclusion from gender lens, and also National Indigenous Disabled Women Association. So there hasn't quite a strong movement, and how we tap in and leverage those existing network, and then also deep dive in terms of how we expand the reach and of these networks at the local or sub-national level. One of the reflections from our work is there are really good networks at federal and provincial level, but it's still at the local level. Persons with disabilities are still not organized, scattered. There are small kind of self-help groups, but don't have the connection or linkage with the kind of provincial and federal level networks. So how we also, and that's where we work in terms of creating local level platform, a network or citizen state engagement dialogue platform. And even as a part of this UNPRPD joint program, created a cross-provincial network. There are provincial networks, but also then how we also facilitate platforms to have cross-pollination of reflections, challenges, and lesson learned across different provinces in the country. So my quick reflection on this is map out, see what exists. While mapping out or looking, please don't forget to bring the intersectional lens. Again, you might end up coming with one kind of network or one kind of typology and missing out the others. And then work, And it's more building up the capital that already exists rather than reinventing the wheel and then trying to take deep dive, that's what the response on that. And then the other point that Monjaro talks about in terms of accountability framework is engagement with Office of the Auditor General. That's something we have started. We had a roundup meeting and they look very strange for us. And so is the case for them to, our identity, why you are coming here, so. But Nepal has recently completed gender PEFA, public expenditure and financial accountability assessment from gender lens. The Ministry of Finance has completed that. And then we have engagement with the Office of the Auditor General, but then they said that PEFA is the ultimate document that they refer to expand the scope of public finance auditing. So they are not, looking into the gender auditing as such. And then our query was like, how can we integrate gender into the public audit of public financing audit, public financing audit. And then the gender PEFA for us looks like an entry point because it has already given us a key recommendation in terms of what are the gaps that is there. So, I'm just, bringing this because this might be a very useful tool. How we also tap in the PEFA framework or gender PEFA framework to engage. And one of the, inputs from the Office of the Auditor General has been some low hanging fruit that we can quickly start as expanding the scope of audit requires quite a lot of decision making and changes in the policy and guideline, but then they are requesting us if we can have a session on gender elements for those auditors who are working as a part of Office of the Auditor General, even to sensitize them, even to let them know that these are the tools and accounting that government has committed, and then how you can bring as a part of the recommendation. Maybe you don't have the tools approved, but then how you bring that. Yeah, I'll stop here.
Thank you, Santosh. We will quickly running out of time actually. So being that 30 seconds, if you have anything to add to that.
Okay. This one point on the collaboration, I think we really have to go beyond the project intervention. That's one. Secondly, with the accountability tools, I think the Ministry of Finance, in case of Nepal, they annually also publish the GRB budget, how much, and that has really provided a good sense of how we are progressing and how we are moving. The parliamentary oversight committees, their role has been very important, and the social audit platforms had been a good platform for everyone to question the parliamentarians and the government officials on the work and how they are taking into considerations the persons with disability issue. The last point with regard to the capacity, I think it's important to build the capacity of the duty bearers because for OPDs, they know their issues largely, but at the same time, how do we sensitize the other part is important, and having strong indicators for any program, because there was also, I saw one question on like on the LPAC, and also how do we see in the MNE. So I think having a strong analysis, inclusion analysis, and having a strong indicator is a most important part going forward. Thank you so much. Over to you, Serge.
Thank you, Binda. We're gonna wrap up, and I would like to thank Amaresh Gopalakrishnan for sign language interpretation. Thank you, Amaresh, as well as Tina Stevenson, who's been working on captioning, trying to keep up with us. Thank you, Tina. I'm gonna turn to you, Monjaro, for last words. If you can address quickly in 1 minute issues of tools and capacities that are available to support this work at country level. If colleagues want to learn more and do more, where do they turn to? And I think Sherry, with also, if you can also speak to that. Sherry first, 30 seconds from OECD. Where is the resource available to help build capacities at country level when that is needed? Cheryl, and then Monjaro, and then we're closing. Thank you so much.
Did you say where is the resource? Is that the question?
Yes. Where are the resources if you need to build capacities for this? There are a lot of questions around where are the tools and resources to do this work?
I mean, I guess the first thing I would do is turn the questions on its head, really, and talk about how we can't afford not to do this, right? And it's that, you know, our countries, they need everyone to be able to participate fully in order to have prosperity. And so it's not about finding the resources to do this, but realizing that unless we do this, our countries are not achieving their full potential. Thank you.
Sherry. Monjaro, do you have the last word?
Thank you very much. Very concretely, I want all of you to take with you two resources that we spoke about, and also my colleague have shared the link, and I just shared the link here in the chat. One is this, of course, the Gender and Disability Inclusive Policy Option, the paper that we launched together with our GRB team. That one is very concrete example. Secondly, Global Toolkit on Intersectionality, and there is a dedicated knowledge cafe with IPPN in the past that I would highly recommend. The reason I'm recommending, because many questions, and I also received the questions, those who registered with this IPPN cafe before, and some of them didn't show up perhaps. But I saw one consistent question: what is the additional benefit of intersectionality? Among others, one benefit I just want to highlight, that it also addresses the reflexivity, the internal inherent bias within us, and intersectional approach particularly address it, as UN, as OECD, as other development partners. Are we really biased towards certain countries, communities? And basically it challenges us as well before we develop the program, before we monitor the program, before we coordinate the program. And I will just leave the thought with you as a parting thought to end the session. Thanks to moderator, very, very tactful moderation. That now in Rwanda recently, UN Women were engaged together with other funds and program, gender audit of organization of persons with disabilities, which gives us a lot of insights that how gender should be mainstream in also OPDs, and it raised the issues of funding, it raised the issues of accessibility. In Georgia, we have the other way of looking at it, disability audit of women's organizations and national governments. And that raises the issues of challenges of disability within women's organization and accessibility. So I'm just saying that there are multiple ways you can look at it. UN Women Rwanda would be happy to share the report that gender audit they did of organization of persons with disabilities. In Georgia, the Auditor General Office, in fact, conducted this. And I agree with Santosh that there is challenges with auditors because they look at performance audit and compliance audit and sometimes very rule bound. And that is the space and limitation we need to engage so that they expand their toolkits and we have a very, very knowledge-based interaction with them, not necessarily bypassing or sidelining them saying that, oh, okay, their recommendations are very, very standard. And it doesn't address the complexity and humanitarian situation that we are living in today. Has to be much more broader and much more innovative than we used to do development in last 10 or 20 or 30 years. Thank you so much. And thank you, sir,
Thank you,
for your
Monjaro.
wonderful moderation.
Thank you. Thank you to our panelists, our captioner and sign language interpreter. And also thank you to the participants who stuck with us past the time. We're running a bit late, but this was a fascinating discussion. I look forward to welcoming you again to the IPPN for further discussion on the gender and disability inclusive policy making. I invite you to join the network to continue the conversation. The resources that have been posted in the chat will all be made available in one space, including the presentation, so that you can access it, as well as the recording of the session on the webpage of the event on the IPPN space. And I look forward to seeing you again next month for our next session. Have a great day. Thank you.
Bye-bye. Thank you.
Thank you.
Thank you. Bye.
Bye-bye.